And I'm here. There we go. Good morning. I'm Shannon Miller, and I'm here with the Miller Elder Law Firm. I'm also here with Dr. Tracey Botha.
Hi, everybody.
And she's going to talk to us today a little bit about hormone balance. And Dr. Botha, can you tell us a little bit about your background and experience as a physician?
Yeah,
or even
absolutely. So I'm a board certified OBGYN. I was practicing both OB and GYN for a number of years. The last year I haven't been practicing gynecology, but I continue to educate and continue with my passion of hormones. I love to tell the story of how I got started. I actually didn't know anything about bioidentical hormones, and I practiced synthetic hormones, and I had a patient come in.
Let me ask you something.
Okay.
You talk about bioidentical hormones.
Yes.
And
synthetics. So what's the difference?
Yeah.
So the difference is bioidentical hormones basically look like our body's natural hormones. So we can't tell the difference when we do those hormones. Synthetic hormones, Premarin is a horse-based estrogen, so it's only 15% of bioidentical hormones. And progestin or medroxyprogesterone acetate or norethindrone is a synthetic progesterone. So bioidentical means that it's basically recognized by our body as structurally identical. So I always say it can hit the receptors and unlock them. So you get the benefit as if it was your own hormones. So
as opposed to a horse's hormone.
As opposed to a horse's hormone.
Okay.
And then the other thing is you can have something that is made from a pharmaceutical company. Estradiol is one of them, but the way that they make it and the way your body absorbs it is different to a compounding pharmacy that makes it. It more on the absorption. So the level that you get is different. And then we all know that things only have to be about 60% of the dose when it comes to a pharmaceutical grade, FDA approved thing. So it's different even if you have something that says it looks similar. That's the confusing part.
So when people go to their doctors and they are, maybe a general practitioner or someone who doesn't know the difference between the bioidentical versus the synthetic, that would be a very good piece of information for our clients.
Absolutely, yes, because a lot of the research is scary, and I think as a gynecologist, I really wasn't familiar in the difference. And this is all, I had a patient who found bioidentical hormones on her own, and she never told me what she was doing. 3 years later, she did tell me that nothing I had prescribed did she need, and she wasn't doing. And I saw her transformation. And on her 4th year, she asked me to figure out what this was because she was sick of driving 2 hours to get this therapy.
Okay.
And so that's what made me go and delve a little bit deeper into it and look at all the evidence.
What did you see? What were the changes that you saw in her, in this particular patient?
Okay, so the first year, which was 6 months, she came back and she just felt better.
Okay.
The year after that's about a year and a half into therapy, she looked good. And I asked her what she was doing, and she said she was doing Weight Watchers and lifting weights. Her skin quality was better, her muscle mass, she was leaner. And then the 3rd year is when she told me she was doing testosterone pellet therapy and driving to Jacksonville to do it. And at this time, I thought this was menopause. I didn't realize this was something that all women need at the start of 20s, 30s, and this was before I was treating men. So it has been a journey for me, and I've been doing it for over a decade. So I've seen the transformation in patients, and I have gone out and done the research, and there's so much evidence-based medicine to support it.
So let's go back to why it is that there is this really kind of scare about hormones.
Absolutely.
And I know I was scared. And when
honestly, I was too. I was too. So I remember in residency, the WHI was a big thing.
What is WHI?
So this was a women's health study that came out, and this was a group of women that were postmenopause, greater than 10 years. They were 70. they went into the study and it was Premarin and medroxyprogesterone, which is a synthetic progesterone.
So back to this idea of the synthetic hormones versus the bioidentical.
Absolutely. And so what it came out and showed was the first year, women had a greater risk of vascular dementia. And that's kind of scary. So we were
Yes.
like, oh, hormones, they cause dementia. We don't want to do that. And then, so the recommendation then was to not do it. And the data was relooked at back in 2006, and it was published in the Journal of Infertility and Sterility. And the data actually showed that the Premarin arm did not increase the risk of breast cancer. The arm that did was the Premarin and the synthetic progestin arm. That was the arm that actually increased. So I think we all misinterpreted the data because it did show, and medroxyprogesterone acetate is still something that we can prescribe. And I was prescribing it until I dwelled in deeper to this hormone therapy. So my goal is to get the word out there. So if you're on that, make sure you change, because I always say you can give a pregnant woman micronized progesterone. That's a natural hormone, and it is calming, it's protective, it actually stimulates genes that cause cell death to cancer cells, and it downregulates estrogen stimulation by 400%. And so when it activates its receptors, it doesn't take away the estrogen importance, whereas the synthetic progesterone blocks the receptor and you negate the importance of estrogen as well. So that is not good. You can't give a pregnant person a synthetic progesterone. It's a teratogen. That in itself, I think, blew me away. Is the difference.
Okay, so we have this study that happened in the early 2000s,
Yeah.
right? And it said a lot of negative things about,
Absolutely.
and it generalized hormone replacement therapy. What we know now is it was really based on these synthetic hormones,
Right.
and that when we delve deeper into these studies, we really didn't take away the right information.
No,
right?
and the study actually showed that women who were less than 6 years from menopause that started it had a 40% decreased risk of heart disease.
Wow.
So even though this was not a good estrogen, it was synthetic, it was only 15% estradiol is what our bodies recognize. It still had help, right?
Yeah.
It still improved. So
what do we know now about the research? What have we learned since this study came out that created this fear?
There's actually a better study,
Okay.
and it's the Nurses Health Study, and it was over a decade, over 80,000 participants in this study, and it showed a 30% all-cause mortality improvement.
Okay, what does that mean?
That means longevity. So the improvement of lifespan.
Okay.
So all cause, so not just cardiovascular protection, but there are other protections there. So the improvement of their overall health was 30% greater than those that were on hormones.
Okay.
So
and let's get back to the basics here, which is, really, what does hormone replace? What does it mean? Number one, like what we're talking estrogen, sounds like we're talking progesterone, maybe adding testosterone, even for women,
Absolutely. So
what do the benefits provide when we do an appropriate bioidentical hormone balance?
It's balance. So not only are you protecting your body, you're feeling better. So estrogen helps with focus. We know it improves our cardiovascular function. We know it improves balance. Progesterone comes in and downregulates that estrogen stimulation on breast tissue, uterine tissue, all the receptor positive tissue. Progesterone helps with sleep. It's calming. Our androgens are very important. Rebecca Glazer, she has great data to show that 10,000 women over 10 years had about a 30% benefit of protection from breast cancer.
Wow.
So we know that when you're on it for at least 2 years, it is protective. So testosterone actually downregulates that estrogen stimulation as well, and it's protective of cancer. So it stimulates a gene that goes in and destroys cancer cells.
Wow.
So when we're young, our risk of cancer is lower. as we age, our inflammatory markers and all of that increase. So there's so much evidence-based medicine to show that it down regulates those markers. So after 2 years of therapy, your inflammation is less.
Wow.
Your reactive markers, where the cardiologist looks and sees if you're at risk for a heart attack, those decrease.
Okay.
All my patients had autoimmune illnesses like Crohn's. After 2 years of therapy, just magically were better. So it has been a game changer for my patient population.
Okay, let me talk a little bit about some of our clients. Love you guys out there. They're in their 70s, 80s, some in their 90s. I would say some of the struggles that we have in those age categories are incontinence, bone health, brain health, heart disease. I mean, all of those, I would say those four are probably the biggest. I know some of our clients with Parkinson's or who have other types of chronic illnesses. Does starting a process of hormone balance therapy improve people in those age categories?
Absolutely. So you're never gonna have the benefit of somebody just starting at menopause, right? So
Okay.
somebody starting at
That
menopause,
would be ideal.
that would be ideal. Starting estrogen will have an 85% reduction in Alzheimer's after being on it for 10 years. So you're not necessarily gonna have that benefit, but you're gonna sleep better. Your lipid panels are gonna improve, the way you feel, your muscle mass, your enjoyment of life, and so it will improve. And the longer you're on it, the longer you see the improvement. You know, muscle mass improves after about a year. 2 years is where really the benefit is. But my patients coming in their 70s and 80s, they are transformed. They live life. They feel better. They sleep better. They're able to function better. It helps with depression. So it really transforms everything.
How about incontinence? Because we know incontinence ends up being the reason that people cannot age in place because they can't get to the bathroom in time. They sometimes get bed sores, it becomes very difficult to stay home if you're in an incontinent situation. And then we know it's the #1 cause of people to be admitted to nursing home level of care.
Absolutely.
So does this type of therapy help?
Absolutely.
How does that work?
So I can just report as a GYN. As a gynecologist, I had multiple older patients who were suffering from incontinence, and it is mortifying. Just by adding estrogen therapy, of course, the balance, it improves the thickness and the quality of their tissue by their vaginal area and their urethra. That in itself can help with incontinence. You know, definitely the incontinence as far as the gotta go now and the big leaks, that improves a little bit, not as much, but it helps you feel better, and so you drink more water, and it does in the end improve.
Okay.
So, you know, it's not gonna be, it's not a magic pill, it's something that does take time, and that's what I always like to tell my patients. And so I do think that the quicker you start on it, I had a patient recently that had incontinence for 4 years, and she came in for rejuvenation. And what did I do? I started her on estrogen therapy with a combination of estrogen and progesterone, and she never came back. You know, I told her to come back if she still wanted the rejuvenation, and then to let her provider know. And so it made a difference. So that in itself will help. Yeah.
Okay, so we talked incontinence. How about bones? Because
Yeah,
that's the other reason
absolutely.
our little people are.
So
constantly
estrogen, so incontinence, it improves your urogenital area, which is, you know, that area by 60%. So decrease UTIs. As you age, and I'm gonna get to the osteoporosis, but as you age, one of the things is you don't know you have a UTI. So it's just change in your ability to think, right? So that decreases by 60%. Now osteoporosis, 35%. Not only
decreases by
35%. I have had patients who've had osteoporosis, and we put them on hormone therapy, we get them adequate, and it reverses it. We can actually see bone turnover with certain tests that we do, and it is dramatically gone. So it's incredible.
What about balance?
Balance, yeah. So estrogen, we need it in men and women. Men get their estrogen from their testosterone. It aromatases over. Women, we add it in. it helps with balance. So if your ability to know where you are in space is improved, not only is it improving by decreasing the bone turnover,
Right.
but it also improves your balance, because balance is what comes before, you fall and you break your bones.
Right.
So definitely, that has been shown to improve.
Okay, heart disease and issues related to heart health.
Yeah, so estrogen is important for that, both men and women. Estrogen therapy has been shown to decrease oxidation of LDLs. Those are the not so good cholesterols, and improves HDLs. And it also has been shown in multiple studies to decrease hardening of the arteries. So it helps with improvement of the endothelial function too.
Wow.
So really, it's a benefit. Heart disease, 50% protection.
Wow.
And that's some of the really good evidence that we've seen in a lot of the studies out there.
Okay, the big one for a lot of people, brain health.
Mhm.
And I know that you talked about, like, we want to start this therapy very quickly after menopause in women, right? But is there really any added benefit to adding hormones for our brains?
Yeah, absolutely. So our brains want to be protected. And so that's the huge thing with testosterone therapy as well. Not only testosterone and estrogen, but they co-help decreasing proteins that are put in our brains as we age without hormones. So, just estrogen alone has been shown to decrease Alzheimer's by 85%.
Wow.
So it's vascular protection as well as that. So definitely.
Okay, great.
Mhm.
All right, so Tracey, you kind of moved from OB-GYN, and now you're doing a lot of this kind of assessment, helping people with some of these issues that as they get older, you're starting to see in your practice.
Absolutely.
What has been your experience with just people coming in, and how do they change? Like, what do you see?
So honestly, I think the huge thing is and I say we, and this is patients who come and see me, feel like they're just not being understood. They're being told everything's normal, and it is. And I always say, normal labs are based on age. So you're not supposed to have them as you hit menopause, right? So my patients come in and they just feel frustrated. They feel like they're going crazy, especially pre-menopause. Their hormones are all over the place, and they feel like nothing is ever going to get better. And they're weepy, cried, depression, both men and women. And some of them have been on multiple, like, benzodiazepines, Ativan, to help them get through, and they're really, really scared. And once I've been seeing them repeatedly, they actually totally improve. I feel like I transform lives. I feel like hormones really make you enjoy life. They save marriages, right? Because you really don't care what you say when you're feeling crappy. Low estrogen causes us to be more impulsive. High estrogen is the opposite. It makes us very weepy.
Okay.
So balance is important in both men and women. And so men are more reactive with low estrogen, and that means their testosterone is low. It increases diabetes. So testosterone at a certain level really is a risk factor for men, and men don't notice it. So a lot of men feel like coming in to get treatment is not a cool thing, that their sexual function is fine. You can have very low testosterone as a guy and still have great ability to perform and have no issues there. So women start dropping in our 30s, so peak at 25. We tell everybody it's just life and they're tired. Men in their 40s. And the more stress you have, I have young men in their 20s who have dropped their testosterone. And so, I remember thinking, all these athletic people having heart attacks and having all these issues, like, it made no sense. But I have so many athletes with very low testosterone.
And you test that. People come to you, they're like, these are my symptoms, and you're like, okay, let's get a blood test. You're not just prescribing.
No, everything's getting tested. And
only when the levels are low.
Absolutely. Everything, so, and it can happen in all ages. I had a patient who was older with really good testosterone. It's unusual,
Okay,
but it does happen. Mostly if you don't feel good,
yeah.
it's a representation of hormones, and we
Okay.
can see it in the labs.
So tell me, you know, in your experience, what are some of the myths that are out there? And I know we just talked about one, that
Mhm.
hormone replacement therapy causes cancer, especially breast cancer. I mean, that's
Mhm.
what I think is probably the number one myth out there, is that it does.
Absolutely, yeah.
I think the other myth is that men don't need hormone replacement. And that if they have a high functioning libido, that definitely they don't need it.
Absolutely.
So you just busted myth number two. What
myth
else?
Number two.
What are some of the other myths out there that you're aware of?
I think the big misunderstanding is testosterone as well. You know,
Mhm.
everybody thinks testosterone is what's the thing that the weightlifters use?
Oh, steroids.
Steroids, yes, and it's not. And there's a difference between synthetic testosterone and bioidentical.
Of course.
Right?
Yeah.
Synthetic testosterone does increase your risk. And the method of delivery, so testosterone, you know, you don't wanna swallow it and have it go through the liver. So testosterone generally needs to be transdermal. And you know, when you look at studies, you have to look and see whether it is a synthetic testosterone or bioidentical.
Mhm.
And I think some of the myths are that as a physician, that's a misunderstanding. I have a lot of physicians who are scared of hormones
Right.
and don't want their patients to do it. And so I always say, you know, right now we know peptides are out there. There's no evidence-based medicine. You feel good, but the FDA is cracking down on that. They will never get rid of hormones because there is so much evidence-based medicine. It may not be approved at your level. So I do tell everybody it's not FDA approved. It's off-label use when it comes to testosterone, but there's so much evidence-based medicine to show the benefit.
How long do people stay on hormones? I mean,
So really, you stay on as long as you want the health benefit. There
Okay.
have been studies to show that women who stop estrogen 5 years are back at the same level as those who've never been on.
so there is a
hormone
real
therapy.
problem if you go on it and then you stop taking it, you're
Yeah.
going to see your body kind of continue that aging process where it left off.
Absolutely, absolutely.
Is this this sounds silly, but is finding the right hormone balance for you really almost like helping you to delay the aging process?
So, I mean, in my personal experience, yes, and that's what I recognized with my patient who came in. I mean, she looked more youthful, her skin quality. We can't say that because there's really no FDA approved studies to show that it improves all these things. But in my experience of doing it over a decade, the thing that really I noticed is most of my patients who've been on hormone therapy, men, it's about 6 months to a year, but they're leaner.
Yeah,
Their labs are all transformed. Women, it takes longer. You know, we don't put on muscle mass as quickly. So my patients, all in year 2 to 3,
yeah.
are naturally leaner.
Yeah.
So they feel better. They look younger.
I know.
So, I could just talk from my experience of taking care
Yeah,
of
definitely.
you know, the patients that I have. So
Yeah.
I say it's my going to heaven medicine that, you know, I'm helping the community feel better.
But someone who's in their 90s
Mhm.
comes to you. I mean, honestly, I have clients who are in their mid-90s, ladies who are
Mhm.
still living at home. They're still
Absolutely,
driving, they're going to the
absolutely.
senior center, they're asking questions
Yeah.
during education programs. Could something like this help?
Absolutely. I treat all ages. So I have a lot of patients in their 70s and 80s who ask me that. And once I start them, they are so thankful. They feel better. I mean, just even sexual function. It's fun to talk to an older patient and they're enjoying sex again. You know, it does improve. Testosterone improves orgasms, and there's some women who really just never had great levels. And when we do the balance, just everything improves.
Yeah.
So, and that's really fun to see that and to see the enjoyment. And you know, I think most of the time we're all most of us are cups half full, right? And you don't realize the change.
Yeah.
And then when we started, even at that age, I mean, I have so many patients and they're just, every day they get better and their partners see that and their families see that, so it's good.
Yeah, that's beautiful.
Yeah.
Okay, I know we're getting close to our 30-minute point, and I wanna ask, our listeners out there, if you have any questions, go ahead and put them in the chat for Dr. Botha, and we will take questions from you guys, and if they come up, we'll see them, so feel free to ask any questions. Let me just hit on a couple other things with you.
Yeah.
So one of the things that I know, we see a lot of with our clients coming in is, insurance coverage,
Mhm,
right?
yeah.
And so we have a lot of clients who are on a limited budget and, they might want to do something like this, but they worry, is it gonna be covered? And if only the synthetic is covered, like, is that beneficial or should they?
Yeah, I mean, they can still do estradiol and micronized progesterone. So they may not be as great a quality of, as the micronized and bioidentical. But it is still going to improve function and we can test the levels. It has to be done at a certain time, but we can just increase the dose accordingly. They won't be able to do non-FDA approved things like testosterone or DHEA. But I do tell my patients they have to look at it as their gym membership. So it's gonna help them overall feel better. And I know that that's not something that everybody can do, but generally the patients that do it, they feel like it is as important as that and they've kept it up, so.
And, one of the things I often will think about for our clients who are in that category where they're in their 70s or 80s, and they are starting to struggle with things like brain health, incontinence, not being able to sleep at night, having mental, their mental clarity is fading. And, those are the things, like when we talk about brain health, we know that with a dementia diagnosis, there's 5 things that can delay dementia, and they're, good eating, full body exercise, brain activities, calendaring, and good sleep,
Absolutely.
And it sounds like all 5 of those things can be improved by a good hormone balance.
Absolutely, it improves all of those.
Yeah.
All of those functions.
So I mean,
it is something that it's funny because it is something that fluctuates. So the healthier you get, the higher certain binding proteins are. So we have to make adjustments, and so we can see that improvement in not only lab work but in the way you feel. So
why do you think? And when I often have conversations with clients about these types of issues, and there does seem to be this very pervasive lack of education as it relates to hormones.
I mean, I was not trained in understanding hormones, and I mean, I'm a gynecologist, so
Right.
I do think that the misunderstanding comes down to our level. So there are doctors out there who know hormones and practice it, and I think you can find it. Neil Rozier is somebody who I recommend, and World Link Medical is a great way to go online and Google and find somebody who understands hormones. And then if you are on Provera, make sure you tell your doctor you don't want to be on it, rather go on micronized progesterone. So I think for me, educating the patient population to share their information and knowledge, share with your friends, share with your family members, is a great way to then educate yourself and improve your own health.
Yeah, and I think like part of the problem is that study kind of came out in the early 2000s. And we all had like a little bit of hope then.
Absolutely.
That this was gonna be something that it turns out it actually is. But at the time when that study came out,
it changed everything.
And it was like, wow, so now we're trying to kind of counteract that misinformation with good scientific evidence. What is the delay with the FDA kind of looking at this evidence that I would say there's gotta be a bunch of research going on now to support some of these findings? Cause like, it would be great if insurance covered this, right?
Vitamin hormones, yeah.
Yeah, but we need the studies to support, we need the evidence.
I mean, the evidence is there.
Yeah,
But I do think, I don't know if this is what it is,
Yes.
but I don't think you can patent something that looks like your body's natural hormone.
oh,
And so I mean, I think somewhat,
okay.
and I
So there's
honestly
no-
think our
no
education,
pharmaceutical
no, and I
company
think
is-
our
okay.
education system is based, I mean, the lobbyists are all pharmaceutical companies.
Right.
So I think a big part of it,
It's all about money.
that's all I learned was synthetic. I didn't know anything. And I remember one of my attendings saying, bioidentical hormones, that's what you need. And I thought, what the heck is that? And,
Okay.
and then you're so busy, you don't have time to really do it. So I'm so thankful for that patient who really made a big difference to me and
Yes.
me to figure out.
Yes, do low hormone levels affect your eyesight?
So yeah, actually.
Great question. Another thing that affects our
yeah.
clients a lot is macular degeneration.
Macular degeneration, estrogen is protective of macular degeneration.
Yay!
So there you go, great question, I
That's
just
a
got
good
to
question.
mention that.
Yeah, and you know, that
Yeah.
is such a chronic problem for our clients.
Absolutely.
And like
Mhm.
when you lose your sight and you know, they're also, how about hearing? Cause hearing is the other one that we see. Have you noticed?
No.
No, oh, okay, not
No.
everything is gonna be.
It's all those big, concerts we went to and our little hairs are all, our cilia are all not functioning, but yeah.
Yes, okay, so, but that is a big problem.
Yeah.
And,
Yeah.
you know, it's kind of the combination of so many things. It's like the incontinence,
Absolutely.
the bone health, the, you know, the shortness of breath, and, you know,
Mhm.
everything kind of creates this perfect storm where our clients,
Absolutely.
you know, they're trying to live independently, they wanna be at home, but.
Well, we
it's-
know how important sleep is.
Yes.
And so
Oh, so.
my goal is to help with sleep. There are other things that we're not even hitting on here. Melatonin is important. You lose that as you age.
Yeah,
It is something that does stimulate glutathione. We know glutathione is an antioxidant.
okay,
Vitamin D, I've never checked somebody who wasn't on supplemental D, and we all think we get it from the sun, and you don't. You get D2 from diet, and the sun converts it, right? But if you don't have enough, and none of us are getting enough, everybody is deficient, and
Yeah.
vitamin D is an antioxidant.
Take
So you
it
need your
every day
levels
at
to
nighttime.
be 70 to 90, and we all think that if we're above 30, we're good, and honestly, that's what I was trained, but it's not. You want your levels higher. It's fat soluble. You gotta take it with K2, not evidence-based medicine, but theoretically it's supposed to help. And it helps with moods. It makes you feel better. So I've had young people I've checked who had a vitamin D of 6, and that's all we did was replace that, and they felt better. So,
Wow.
it's really not just hormones. It is
Okay.
diet, like you said.
Mhm.
It's making sure you do have adequate nutrition. It's making sure that you do have your vitamins, all of that. And we don't absorb enough in the foods nowadays. So
Well,
everybody I check is low.
Yeah, and I mean, hydration. I mean, the UTI
Yes.
epidemic out there.
Absolutely.
And in
And if
particular,
you're dehydrated, that does increase incontinence. So a lot of people think that they need to not drink, because then they're not gonna have anything there.
Mhm.
But the more concentrated your urine, the more it irritates your bladder, the more you have bladder spasms.
Okay,
So things that are gonna increase that are gonna be anything acid, caffeine, tannins, anything like that is gonna irritate your bladder and make that gotta go now. The other thing is if you have a lot of varicosities, you can have more incontinence at night.
what's varicosities?
Those are leg veins. So if you have leg veins, what you wanna do is elevate your legs for about 2 hours before bed.
Okay.
And that'll help that drain, so you won't be getting up as much at night. And
Yeah.
so there are little things that you can do to improve everything.
Yeah, there was another physician that we were talking to about sleeping, at an educational program, and, you know, they were recommending 8 to 9 hours as if
Mhm.
we're over 75.
Yeah,
And I was like, look, my clients, they have to go to the bathroom.
yeah.
And he said, even if you wake up and you've only had 6 hours of sleep, cause you have to go to the bathroom and you can't get back to sleep, it would be great if you could do that all in one, do a full 8 to 9 hours at once. But he said taking a nap during the day is the second best way to get that 8 to 9 hours.
Absolutely.
So,
And making sure you get into bed on time. So your REM sleep is the sleep that clears everything from the day.
okay,
So if you're like waiting and going to bed and pushing that circadian rhythm, you're
Yeah.
not gonna get that good sleep. So all of that definitely is gonna help.
And going outside sets your circadian rhythm,
Yeah.
right? So you
Mhm.
have to get that natural light in the day and preferably first thing in the morning and then sometime
Right.
during the day. If you're inside all day because it's rough for you to get outside, change it up.
Absolutely, and there are a few more things.
Yes.
Alcohol and caffeine sometimes can affect deep sleep. So, that is something you just have to also keep an eye on.
Yeah.
So deep sleep's important. If I have caffeine after 11, I don't get great sleep. And
Wow.
so, some people do. My mom can have it right before bed. So figuring that out is a really good thing for you too.
Okay, how about,
Another question.
oh, okay, great. But while I look at that, how about L-theanine or theanine?
Oh, yeah,
Yeah,
magnesium.
yeah.
So magnesium is another thing that's extremely important. And so that's a magnesium that crosses the blood-brain barrier. A lot of people don't realize that there's a difference in magnesium. I have a lot of patients that are on magnesium carbonate. And so it's not a good bioavailable one. So glycinate, that one is a great one.
Okay.
And so magnesium helps with muscle spasms. It's in every metabolic process that we use in our body, so that's definitely something to add.
Okay.
Citrate is a crossover, so it's gonna,
Magnesium citrate.
yeah, so citrate will stimulate bowel movement, so some people need that. Others don't, and so, citrate's not one of my favorites, but
Right.
that's what that magnesium calm is.
Yeah.
A lot of people do, so
Okay.
you just have to watch.
Question, what is an estimated time frame from the initial consultation to the time of actual treatment?
So it really depends on the patient. Some people come in with all their labs and I can evaluate them. So that's a big thing. So I always order labs. I do it annually. I'll do it if we've been great and something changes. And so, and a lot of people don't have all the labs I need. So in general, labs take anywhere from 4 days to 10 business days to come back. So I'll see somebody back and then we get started.
Yeah.
So,
But I mean, then, even, it sounds like even with the treatment, and yes, I can speak from experience, it does take a little bit of time
Okay.
for you to it's not instantaneous.
no, so everybody's different. Everybody's treatment plan is different. Everybody needs different doses. So there is optimal estrogen, but if you haven't been on estrogen, I'm not gonna start you on that dose because you're gonna have more side effects. So it is very different for everybody. I tell everybody, you gotta give me a year. It usually doesn't take that long, but I have not had a patient yet that I haven't been able to help.
Yeah.
And I've been doing this in over a decade, so that's saying a lot. And so if you're patient, it's not a magic pill. I think a lot of times there's frustration because their best friend does it and they feel amazing. And they're like, what the heck are they doing? All of a sudden they've come in and they're happy. So they want that. The ones that come in and transform immediately are gonna be the athletes that, eat.
Metabolize really
Well,
quickly.
and they eat like a really good combination of really healthy foods and they've just dropped. I start them and they're good to go, but the rest of us, it takes time.
Okay.
But it gets better, so it's.
Stick with it.
Yeah, stick with it, so you will feel better. A few people do take a little longer than others, and that's just based on the dosing and how your body's doing with it.
Yeah, and I would say from my personal experience, I wish I had journaled about how I feel today versus, 2 weeks into it versus a month into it
Mhm.
versus 6 months into it. Just waking up in the morning, your quality of sleep, how your brain functions. I can say for me, my brain got so much better in 4 months. I
Well,
mean,
and that's because your sleep quality improved,
Yes,
right?
so
When your
much.
sleep improves, if you don't have good sleep, the next day is so hard to deal with. Pain is worse.
Yeah.
Just almost everything,
Yeah.
just dealing with day to day is not great.
Yeah.
So it all adds up.
Yeah, and then I would say the quality of my body, being able to go to the gym and do way more than I ever was doing before I started the treatment process, so.
Right.
All right, you guys, well, I think we are actually a little bit out of time. Is there anybody with any last minute questions before we wrap it up? Okay, so before I let you go, I do want to talk about bringing you back.
Absolutely.
While I have you on camera, I think one of the things that, we talked about a little bit was, incontinence.
Mhm,
And we talked about how we can use hormones to help with that.
absolutely.
But I want to bring you back to talk about other treatment processes for incontinence for both men and women.
Yeah.
And like what is available out there, because I would say that, again, it's the number one reason that people get admitted to nursing homes
Yeah,
is incontinence
absolutely.
issues. And I really do want to have a deeper dive
Mhm.
into pelvic health, just in general, strengthening it, what can we do with like interoception? You guys have heard me talk about interoception a lot lately. And I think we can dial into that side of things a little bit more, just things that you can do physically for
Yeah,
yourself.
absolutely.
But then also, what procedures are available to men and women to address things like, if there are actual surgical procedures that can help people with incontinence, and how available is that?
Absolutely.
Okay, so we're gonna bring you back
Sounds
on
like a
that.
good thing, yeah.
Wait, there was something else I wanted to bring you back on. No, I think that was the one thing that was really important, but of course, as we kind of go through our lives, I'm sure there's things that you're gonna think about,
Mhm.
that as you see your older patients coming in, put it on our radar, because then the
Yeah.
next time we come back, we can talk about some of these other things that
Yeah,
you're seeing that can
sounds
benefit
good,
people.
yeah.
Sexual, dysfunction, I know is something people don't really like to talk about. We're probably not gonna see a question in the chat about it, but that may be something that we can also talk about as well when you come back.
Sounds good. I think
Okay.
the big thing that everybody always says to me is they're pissed off they didn't know about it. So,
Yep.
talk to your doctor.
Okay, there's one more question.
Okay.
Can you please give us your contact information? How do we begin this journey? Okay, that is such a great question. So Tracey, we will, put her link in the webinar, but if you want to go ahead and give out your information.
Yeah,
we'd
so,
love to have you do that.
I am Tracey Botha. You can find me at Moy Medical Spa. The phone number is 352-339-4845.
And that's MOOI, and we're here in Gainesville.
Yeah, Medical Spa and
I'm
Laser
not-
Center. So you can
Literally around the corner from us.
and you can Google, you can make appointments online, but I also have somebody that's answering the phones. I'd be happy to schedule you. She's wonderful, so.
Thank you so much for being here.
Absolutely.
You're such a queen.
I love this woman. I don't ever do this, and
She
so.
does it. We're very lucky. So
Yeah.
thank you so much for that. Okay, you guys, have a good one.
Bye, everybody.
Bye.